Welcome to my channel. Today we are to talk about laxative and purgative. They are basically the same thing. They are medication used to treat or manage constipation, and they do so by either bulking the stool or softening the stool or stimulating the GI motility. The effects of bowel movements determine the type that we will talk about. So if the effect is mild, we normally term this as laxative. It is if the effect is strong, then purgative. So they are basically the same thing. The difference has to do with the effect on the bowel movement. Before we get to the laxative, let's discuss something small about constipation. So when you talk about constipation, you should think about 5 things that I'm coming to talk about. And one of them is difficulty in stool passage. So the patients find it very difficult to free the bowels. Aside that, the patient cannot frequently free the bowels. So there is infrequent bowel movement. Thirdly, some patients with constipation, they will strain before they can free the bowel. So straining before they can free the bowel. We can also talk about, you have this feeling of not being able to empty your bowel freely. So incomplete emptying of the bowel. And lastly, what we can see with some people with constipation is that their stool is hard. So stool hardness. So these 5 things actually are some associated features or characteristics of people with constipation. People tend to think they have to always free their bowel, but actually the normal bowel habit, the natural frequency of freeing your bowel should be like 2 to 3 times per day for some people, up to like 2 to 3 times per week for some other people. So it's not really a thing that you have to always free your bowel. And what are the causes of constipation? We have primary cause, which is normally unknown. You don't actually know what is causing the constipation. And we also have the secondary causes. So secondary causes, we can have someone being on a particular drug like opioid. One of the side effects of opioid is constipation because they slow GI motility and can cause constipation. Some iron preparation and calcium channel blockers, etc. One of the secondary causes that we can also talk about is the lifestyle of the patient. So some patients, they don't take in enough fiber diets like fruits and vegetables, like grains, like cereal, wheat, rice. So they are not able to bulk up their stool to improve bowel movement. So lifestyle, we are talking about diet. We're also talking about inadequate intake of fluid. So for you to prevent constipation, we normally recommend that you take about 2 to 3 liters of fluid per day. We can also talk about lack of exercise. That's one of the reasons why constipation seems to be more common in old people, because they lack energy to exercise. Alright, so this is just a small or a brief discussion on constipation. Our main topic is to talk about laxative and purgative. So we'll go straight to laxative and purgative, talk about the classes, and each of the classes will get to know some salient points that is very useful for students, for other healthcare professionals, and for our patients as well. So stay with me. All right, let's go. Laxative and purgative. First of all, as I previously said, when we talk about laxative or purgative, there are medications that we used in management of constipation, and their mechanism of action is to increase the bowel movements, and they do so by either bulking up the fetal mass so that you can free your bowel. That's one. Or by softening the stool so that you will be able to pass out those stools, or by stimulating the GI motility. So we have about 4 main classes or types of laxative that we will discuss in this video. And the first one is based on how they are able to manage constipation. We have bulk forming laxative. We also have osmotic laxative. The osmotic laxative, they basically draw water into the intestine so that they will able to soften the stool as well as stimulate the GI motility. We also have the stimulant laxative. What they do is they basically stimulate the intestine to promote bowel movement. And lastly, we have the stool softness. This softens the stool so that you can easily pass those feces. So we'll take each of them one by one to know how they work basically, and to know some very useful information that will help our patients, that we pharmacists can advise healthcare professionals on, as well as students. So the first class that we will talk about is bulk forming laxative. They are basically the first choice that we will think about during or when someone is having constipation. So how do they work? So one main example or common example of bulk forming laxative is the Ispaghula Husk, normally found in Fybogel. Fybogel is one brand that contains Ispaghula Husk. So this is how they work. Basically, these bulk forming laxative, they are indigestible fiber. So when you take them in, they pass through the stomach and in the intestine. The first thing that they will do is to absorb water. They will absorb water onto the indigestible fiber. So let's consider this to be the intestine. They absorb water onto it. So one thing that we normally advise patients when they are taking this bulk forming laxative is to take in with a lot of water. They need water to work. If you take in the bulk forming laxative without taking in a lot of water, they will rather lead to what we call intestinal obstruction. So you advise the patient that he or she should take in a lot of water with the bulk forming laxative. So when they take in the water, the indigestible fiber will absorb the water into it, and that will cause the fiber to swell. They swell to form a gel, so gel formation. So this gel contains the fiber, the water, and the fecal mass. So when this happens, they create a very soft stool and a large stool. And when the stool is softer or is large, they stimulate the GI intestine to move or to undergo what we call peristalsis. So the bulk gel stimulates natural contraction of the GI so that bowel movements can occur, and then you can freely or easily pass those tools out. So that's how basically the bulk forming laxative work. They are indigestible fiber. You have to take in it with a lot of water. In the intestine, they will swell. When they swell, they are able to form a large and a softer fecal mass. And for that matter, they can stimulate the GI motility so that you can easily and freely pass out those stool. And I said one of the common example is Ispaghula Husk. That's found in Fybogel. We have other examples for my students. You can talk about Steculia. That's also an example of bulk forming laxative. But in this particular video, we will be focusing more on the Ispaghula Husk because that's one of the commonest drugs that you find on the market. Our next thing to talk about are things that you have to know on Fybogel or Ispaghula Husk. As I said, we'll use Fybogel to talk about a lot on the bulk forming laxative. So the first thing that we can talk about is age group. With Fybogel, first of all, a sachet contains 3.5 grams of the active ingredient, which is the Ispaghula Husk. For the age group, this particular product, the manufacturer recommend it to use in individual greater than or equal to 6 years. So it can be used in adults like you and I, and also in children 6 years and above. It is usually the first choice of laxative in almost a lot of constipation type, except in opioid induced constipation. We'll get to know why. Adequate fluid intake. As we previously said, they need a lot of water to form the gel. So if you don't take in a lot of water, the gel formation wouldn't happen. And what did I say? The fluid intake should be at least 2 to 3 liters per day, so that you prevent what we call intestinal obstruction. If you don't take in with a lot of water, they will rather form a hard mass that can obstruct the lumen of the intestine, and that will worsen the problem. So you advise the patient, you take, after you've taken the medication, continue with adequate fluid intake, like 2 to 3 liters per day. The onset of action of this class of laxative, normally they don't give an immediate relief. So as I said, they are indigestible fiber. They are normally given to individuals who, for some reason, they can't take in fiber, or they are not able to get enough fiber in their diet. So their onset, it takes up to like 3 days for you to see an effect. So we normally say it to be a prevention. It's normally a prevention rather than an immediate effect. And with the onset of its effect, it's therefore better for you to advise your patient that continue to use this medication consistently, because the effects will take time to take place. How then do you use it? So this medication, it comes as in Fybogel, it comes as a sachet, and each sachet, when you take each sachet, it contains 3.5 grams of the Ispaghula Husk. So for adults, for those 12 years and above, normally it is recommended to take a sachet in the morning and a sachet in the evening after food. And this is how you do it. You take a sachet, you empty the sachet, and then you dissolve it in at least 150 ml of cold water. So as I said, for an adult, 1 sachet in the morning, 1 sachet in the evening after food. But you have to take the sachet, empty the sachet into at least 150 ml of cold water. We'll explain that. For children 6 to 12 years, it's the same thing, but in this situation, they will take half a sachet in also at least 150 ml of cold water. So why cold water and not warm water or lukewarm water? So cold water is actually recommended because, one, cold water ensure that the gel formation is optimum. As I said, they are indigestible fiber. They draw water to form a gel. Taking in with cold water ensure that gel is formed so well. Secondly, taking it with cold water and not warm or lukewarm water prevents premature swelling of the gel. So they prevent premature swelling of the gel. So when you take in the Ispaghula husk, we expect that the gel formation will occur in the intestine, either the small or the large intestine. When you take it with cold water, that's what happens. But normally when you take it with warm or sometimes lukewarm water, there is premature gel formation. The gel formation usually form either in the stomach rather than in the intestine. That's one of the reasons why you advise the patient with this product, Fybogel. The manufacturer advised that you take in an at least 150 ml of cold water to ensure that the gel formation is optimum and also there isn't any premature swelling of the gel. You have to also take it after food, and that's very simple. You want to relieve the patient of constipation. So you take it after food so that when it absorbs water, it can take in all the food residue to form the fecal marks, and that can stimulate the GI motility so that you can free your bowel. Number 7, on the things you have to do on Fybogel is to number 7, wait at least 1 hour after you've taken the evening dose. As I said, you put 1 sachet in an at least 150 ml of cold water. You drink it immediately in the morning and then in the evening. But in the evening, wait for at least 1 hour before you go to sleep or before you lie down. This is to prevent intestinal obstruction. You don't want the lumen of the intestine to be obstructed. So wait 1 hour after you've taken the evening dose before you retire to bed. 8 is very important. We don't use the bulk forming agent in constipation, which is caused by opioid. You know, one of the side effects of opioid is constipation. Examples of opioid include morphine, fentanyl, pethidine, etc. One of the commonest side effects of opioid is constipation. And take it from me, we don't use bulk forming laxative in a constipation which is caused by opioid. The reason is that based on the mechanism of opioid in causing side effects, they act on mu receptors. They act on their receptors on the intestine, and when they do so, they slow the GI motility. They reduce the GI motility. Okay. How then do the bulk forming laxative they work? They draw their indigestible fiber. They draw water in the intestine. They swell up and they stimulate what? The GI motility. They swell up to stimulate the GI motility so that there will be bowel movement. If you are having constipation which is caused by an opioid, the opioid is already sitting on the mu receptor, preventing that GI motility. That's the bulk forming laxative is supposed to stimulate. So when you take bulk forming laxative in opioid induced constipation, you wouldn't see an effect. It wouldn't work. The patient will still have constipation because that GI motility to be increased by the bulk forming laxative is being slowed by the opioid. So we avoid in opioid induced constipation because the effect of the bulk forming laxative will be nullified. Will be nullified by the opioid. So bulk forming laxative, as I said, is one of the first drugs that you use in almost all kinds of constipation, but we avoid them in this opioid induced constipation because it wouldn't work. It wouldn't be effective. In pregnancy, bulk forming laxative is one of the safest laxative that can be used in pregnancy and breastfeeding. As I said, they are just natural indigestible fiber. So when you take them, they are indigestible. For that matter, they wouldn't be absorbed. They wouldn't get into the blood. So they wouldn't have effect on the mother and as well as the baby. So it's very safe in pregnancy. Very safe. And then the last but not the least that we should know, that every patient should know, that me and you we should know so we can advise our patients the side effects of the bulk forming laxative. One of the commonest side effects is flatulence. You have to let your patients know that this medication, you are going to pass gases a lot. Bloating. Bloating is also one of the commonest side effects with the bulk forming laxative. And then the last thing that we also have to be mindful of is bronchospasm. Very interesting. The medication, the Ispaghula Husk, is in a sachet and it comes in as a powder form. And these contain allergens. These can be, some patients can actually react when they inhale the powder. So normally you advise the patient when emptying the sachets, they should not inhale the powder because some patients might have their respiratory system reacting to those allergens in the powder. That can lead to what? Bronchospasm. So advise to make sure not to inhale. Advise not to inhale. Alright guys, this will be the end on bulk forming laxative. We talk about the mechanism of action and the important information about 10 things that you have to know on bulk forming laxative. Our next will be on the osmotic laxative. Thank you for now. My name is Dr. Leon. Please subscribe, please, to my channel. Bye bye.